will announce on Wednesday. Something else? Millions of Americans lost their jobs, and with the jobs, their health insurance due to the pandemic. So President Biden is set to take executive action as early as Thursday to reopen the federal marketplaces selling Affordable Care Act health plans and make Medicaid more accessible to those in need. And President Biden issued an executive order rescinding a ban on transgender people serving in the military. The Senate on Monday confirmed Janet Yellen to be President Biden's Treasury Secretary. The first woman to serve in the post was also the first female Fed chair. Moving on to the coronavirus, President Biden says he hopes the U.S. will soon be able to administer 1.5 million doses of the vaccine every day. And the Defense Department is considering deploying thousands of troops to help reach that goal. One official said up to 10,000 troops could be involved. While Americans are waiting for vaccines, health officials say they're extremely worried about new COVID-19 variants detected in the U.S. In New Zealand, who successfully eradicated the virus, Prime Minister Jacinda Ardern says the country's borders may stay shut for most of the year to prevent outbreaks. What a difference 6 days makes. The Biden White House is putting some media outlets, those that are in the business of misinforming the American public, on notice. Deputy Press Secretary T.J. Ducklow on Monday said, quote, "We expect reporters covering the White House to operate in good faith and tell their audience the truth. And this White House will do the same. We are moving forward with that mutual understanding. Organizations or individuals who traffic in conspiracy theories, propaganda, and lies to spread disinformation will not be tolerated. And we will work with the White House Correspondents Association to decide how to handle those instances moving forward." Truth, what a concept. And that's just a bit of what's news for now. I'm Nicole Sandler. If you appreciate these reports and the Nicole Sandler Show, I hope you'll consider making a contribution. My work is 100% listener supported, and I can't do it without your help. Find out more at NicoleSandler.com, and please click on that donate button.
The Leslie Marshall Show, the only true democracy in talk radio, of, for, and by you, the people. Live nationwide and streaming live at lesliemarshallshow.com. Call in with your thoughts at 888-6-LESLIE.
Tuesday. I was going to say, I usually say on the radio, don't be looking at me, but you can be looking at me. Hello, how you doing? Everybody out there on Periscope via Twitter, or thank you to Twitter, Facebook Live, YouTube Live, and of course, those of you listening live on the radio, on our stream, or any stream where you get the show, or people who listen to it when they want it, the way they want it. And that is via the podcast. I'm Leslie Marshall. Great show in store for you on this Tuesday. It is cold. We had hail here yesterday in Los Angeles. My kids love it. My kids love cold weather and snow. Being from Boston originally, I do not. Most people think that I'm used to cold weather because I grew up in it. No, I'm always freezing. I like warm temperatures. But anyway, you didn't tune in to hear all of that about my life. So let's get to it and check what is, as we like to do at the top of the hour on this program. Let's check what's ripped. First up, federal allocations of coronavirus vaccine doses to states and other jurisdictions are expected to increase by about 16% next week, easing shortages that have intensified nationwide without fully alleviating supply problems. Want you to know, my husband's getting his first dose this week. My husband actually could have gotten it a few weeks ago, but he's an orthopedic surgeon, and he wanted to let people who maybe closer to the front line or older than him go first. Kudos to him for that. But he is getting it this week. He told me, though, a lot of the women that he works with, and this is specific to women, they are concerned if they want to have kids someday, if there will be any negative repercussions for having this vaccine now, because, obviously they haven't had the normal, 5 to 20 year period to research it. So that's when you see those, a third of healthcare workers don't want it. Some women who are of childbearing age are concerned what that'll mean for them if they want children or more children than they have currently. Jeff Zients, who's coordinator of the White House's coronavirus response, is expected to inform governors of the increase. He's having a call with governors today, according to two people familiar with the situation. Of course, they always have to speak on condition of anonymity. They're not authorized to discuss it. That's how the press gets it, from these leaks. The weekly allocation is forecast to go from about 8.6 million doses to about 10 million doses. The vaccine is distributed on a population basis among 64 jurisdictions, including 50 states, 8 territories, and 6 major cities. Now, Zients is expected to stipulate the increased supply will come from releasing more doses of Moderna's vaccine, one of 2 authorized for emergency use in the U.S. The other available product is also a 2-dose regimen that was developed by Pfizer and the German company BioNTech. The stepped-up allocations are projected to last through the coming weeks. They'll be welcome news to state and local officials who have implored the federal government for better forecasting of vaccine availability and transparency about supply. Now, the White House declined to comment, but in a briefing earlier today, White House Press Secretary Jen Psaki said, "There are some calls this afternoon with governors to brief them on these plans and give them an update on how we will continue to work together even more efficiently." I quote. She also said President Biden would be addressing vaccination later today. Both companies have said they're ramping up production. Each has pledged to provide 100 million doses to the United States by the end of March, another 100 million in the second quarter. That's good news. Now we got to get coordination between federal government, state government, and the private entities like Walgreens, CVS, Rite Aid, etc. to, really mesh. That's been part of the problem. Let's rip another. Trust surged in the federal government since President Biden's inauguration, at least when it comes to COVID-19. But that's almost entirely because Democrats have gained confidence, according to the latest installment of the Axios Ipsos Coronavirus Index. The big picture here is that Americans reported the biggest improvement in their mental and emotional health since our survey began last March, and the highest trust levels since April about the federal government providing them accurate virus information and looking out for their best interests. Can I just say, as a Democrat, when Donald Trump was elected, I'm not going to lie, I think I cried for 3 days when Hillary lost. Not only because she was my candidate, because I was very frightened what Donald Trump would do. I am married to a Muslim American. I was very concerned about the Islamophobic attitude by many Trump supporters and by him himself. And in addition to that, I was very concerned what he would do to this nation, including the division. And I was afraid of something like January 6th happening, but I never said it because it would be highly irresponsible or to give people ideas if that wasn't in anybody's minds. But I wasn't surprised, sadly, on January 6th. And I do want to say it is so refreshing to me, not only as a talk show host, a political analyst, Democratic strategist, as a voter, as a woman, as a human being, to have normalcy return, decorum, a president who acts presidential, people keeping us truly in the loop, science, medical advisors making decisions about medical pandemics, and a press secretary who doesn't personally attack individuals or lie, even if you may not like her answer. It is a press secretary's job to make the president look good, obviously, and it is also a press secretary's job. But, refreshing, I'm hearing out of Washington that people are saying with this White House, if they don't know the answer, they say, I don't know. And by the way, that's incredibly powerful. It's called honesty. You don't need to be the smartest person in the room. My husband is very, very, very successful as a physician and has a huge following. It's very hard to get in to see him or get a surgery because so many people like him. And that's because he's honest. And there are times he says, I don't know. None of us know it all. I mean, except me. No, just joking. But you know what I'm saying? It's like, I just have to say, I think many of us are sleeping better because we know we're not going to have in the middle of the night our phone going off with some tweet or somebody's finger on the nuclear codes, or somebody who's, PO'd, some, ally of ours, or, worse yet, a terrorist organization. I mean, the list goes on. Anyway, trust surged in the federal government since the inauguration when it comes to COVID, like I said. And I was telling you about this big picture. The highest trust level since April about the federal government, providing them accurate virus information, looking out for their best interest, not Biden's best interest. The survey also found a new high for interest in getting vaccinated. Half of the respondents now saying they want to take it as soon as they can get it. Just 12% said they'd signed up or made an appointment to get the vaccine. Overwhelming majorities had not yet sought out information from their doctors, pharmacies, government health departments, or social media. And let's be honest, they're afraid. We've lived in a fear-mongering, spread the fear, be afraid culture for 4 years. And there are many people afraid of voting, afraid of not voting, afraid of the government, afraid of the press, afraid of this vaccine, afraid of getting it, afraid of not, afraid of COVID, or afraid it's some made-up virus, which it is not. A lot of fear, sadly, has been dictating our lives. Hopefully that will change soon. So here's what folks are saying. Pollster Chris Jackson, who's the senior VP for Ipsos Public Affairs, he said the rising numbers are indicative of the switch in government and that it's almost entirely based on trust in Biden. And that would be a good thing because more people now getting the vaccines and confident to get them. He said Biden has an opportunity to get people into it, but he's going to have to do it. It's not just going to happen. People are kind of waiting to be told to take the vaccine. Respondents were relatively confident, 62% in the Biden administration's ability to make the vaccine widely available, divided about 52% about whether the new government can quickly revive the economy. And Jackson said that suggests the public may be less patient with Biden pursuing policies right now that aren't directly tied to dealing with the virus. It also might signal that Americans know that Republicans will vote Republican, Democrats will vote Democrat, and we're going to have some gridlock because the Senate's 50-50. The Democrats don't have as strong and large a majority in the House. And it's politics unusual, as we're seeing from Republicans who are preventing stimulus checks from going out to Americans with the package that the president has proposed and that Democrats support. Now, Republicans' trust in the federal government was flat, marginally lower than in the survey taken between January 8th and 11th. That was the last time in this poll that question was asked. Independents, about flat, marginally higher, so, mid to high. What's really driving the trust gains is how deeply Democrats distrusted former President Donald Trump, how strongly they trust Biden as opposed to that, translating to a 25 to 30 percentage point gain just over the past 14 days. And it's worth noting that Republicans are not abandoning trust proportionately to Democrats' gains in trust. 58% overall say they trust Biden to give them accurate information. 27% say they trust Trump. So you might say that a quarter of, or a fifth, a little more than a fifth, if you look at the demographics with, a poll, if this is, how accurate it is, about a fifth still trust the president. And a lot of those are Republicans. Overall, 50% of Americans now say they have a great or fair amount of trust in the federal government to provide accurate information about the virus. 50%, not very much trust or none at all. That's the highest it's been, by the way, since April 3rd through 6th back in 2020, a survey taking men, comparing with a 40% trust versus 60% distrust split when that question was asked just 2 weeks ago. I'm Leslie Marshall, back with more Ripped right after this. Don't go away.
Hey, Dad, how do airplanes fly? What's in this box? Can I touch this? Where does sand come from? Is this tree good for climbing? What happens if I mix these two things together? How are babies made? What does this thing do?
Kids are curious about everything, including guns. Talking to them about gun safety in your home is a good first step, but you can do more. Always keep your guns locked, unloaded, and stored separately from ammunition. Storing your guns securely is the best way to prevent family fire, including unintentional shootings. For more information on safe gun storage and ways to keep your family safe, visit endfamilyfire.org. That's endfamilyfire.org.
What do we keep in the attic? What's this thing called? Can I ride my bike backwards?
Like I said, kids are curious. It's up to us to keep them safe. Brought to you by End Family Fire, Brady, and the Ad Council.
Wake up and text. Text and eat. Text and catch the bus. Text and miss your stop. Wait. Text and be late to work.
Sorry, I'm late.
Text and work. Text and pretend to work. Text and act surprised when someone calls you out for not working.
Who, me?
Text and meet up with a friend you haven't seen in forever.
Hi.
Oh, hey.
Text and complain that they're on their phone the whole time. Text and listen to them complain that you're on your phone the whole time. Text and whatever. But when you get behind the wheel, give your phone to a passenger. Put it in the glove box. Just don't text and drive. Visit StopTextsStopWrecks.org. A public service announcement brought to you by the National Highway Traffic Safety Administration and the Ad Council.
What does your toothbrush, a fish dinner, and your running shoes have in common? Plastic. We now live on planet plastic. Billions of tons of waste from everyday products made of these chemical contaminants are strewn literally everywhere. On the highest mountaintops, into the deepest seabeds, in dense tropical jungles, and all across barren deserts. It's estimated, for example, that in less than 30 years, the gross volume of discarded plastic in our oceans will outnumber fish. From grocery carry-out bags to shower curtains to almost invisible bits of microplastics, the vast tonnage of this trash increases every minute, with an afterlife lasting centuries, wreaking havoc on ecosystems, destroying species, and infusing our water, air, soil, food, and us. Consider just two common products, your toothbrush and your sneakers. Until the 1930s, toothbrushes were made of degradable natural components. Since then, practically all have been throwaway plastic brushes. But there is no away, so nearly all of the trillions of brushes we've discarded in the past century are still out there, somewhere on the land or in our water. Moving from your teeth to your feet, consider that millions of sneakers are sold in the U.S. each year, advertised as being athletic and cool. What's uncool is that they're made almost entirely of melted and molded plastics that are practically impossible to recycle. So, after a short time in our closets, sneakers spend an eternity as globs of toxic plastic trash. This is Jim Hightower saying, we're being choked by our own synthetic waste, from billions of plastic bottles and cigarette filters to tons of straws and synthetic rubber tires. To help stop the insanity, contact Beyond Plastics, beyondplastics.org.
If you miss Leslie on TV this week, catch up at lesliemarshallshow.com.
Hey there. We are back on Leslie Marshall. Welcome back. Part two, for ripped from the headlines. Let us continue. Well, President Biden is scheduled to take executive actions as early as this Thursday. That would be to reopen the federal marketplaces that sell the Affordable Care Act health plans and to lower recent barriers to joining Medicaid. The orders will be his first step since taking office to help Americans gain health insurance, a prominent campaign goal that has assumed escalating significance as this pandemic has dramatized the need for affordable health care for so many. It's deprived millions, this pandemic, of Americans' coverage as they've lost their jobs and the economic fallout. Remember, there are many people who have insurance through their employer, and the COBRA period for some has ended, or maybe they don't have COBRA, depending on the type of program their employer provides. So under one order, healthcare.gov, it's an online insurance marketplace for Americans who cannot get affordable coverage through their jobs. It's going to swiftly reopen for at least a few months, according to people inside and outside the administration familiar with the plans. And ordinarily, signing up for such coverage tightly restricted outside a 6-week period late each year, but obviously that's going to change. Another part of Biden's scheduled actions, the individual said, is intended to reverse Trump-era changes to Medicaid that critics say damaged Americans' access to the safety net insurance. Now, it's unclear whether the president's order will undo a Trump-era rule allowing states to impose work requirements. A simple direct federal health officials to review rules to make sure that they expand coverage to the program. That currently insures about 70 million low-income people right now in the United States. Now, the actions are part of a series of rapid executive orders that the president is issuing in his initial days in office to demonstrate he intends to steer the machinery of government in a direction far different than that from his predecessor. And over 84 million people voted for him to do just that. He is keeping his campaign promises. Why people are so surprised, this is not, a rabbit that came out of his hat. He has been very vocal about this prior to even becoming the nominee. He has been saying for many months that helping people get insurance is a crucial federal responsibility. But until the actions planned for this week, he's not yet focused on this broader objective, shining a spotlight instead on trying to expand vaccinations and other federal responses to the pandemic. The most ambitious parts of his campaign healthcare platform would require Congress to provide consent and money. Those include creating a government insurance option alongside the Affordable Care Act health plans sold by private insurers and helping poor residents afford ACA coverage if they live in about a dozen states, which currently have not expanded their Medicaid programs under the decade-old health law. Now, a spokesman for the White House declined to discuss the plans, but two HHS officials, of course, remaining anonymous, said that the event at the White House not announced, that they were anticipating that the event would be held this Thursday. Now, according to a document that was obtained by the Washington Post, the president also intends to sign an order rescinding the so-called Mexico City rule. That rule compels nonprofits in other countries that receive federal family planning aid to promise not to perform or encourage abortions. Biden advisors last week previewed an end to this rule, which for decades has reappeared with Republicans occupying the White House and vanishes under Democrats. Again, no huge surprise. If you think about it, though, a federal agency can't encourage and certainly can't perform an abortion. A federal agency. Look at the wording. The document also says Biden will disavow a multinational anti-abortion declaration that the Trump administration signed 3 months ago. The action is to expand insurance through the ACA and Medicaid, coming as the Supreme Court is considering two cases that could shape the outcome of this. One case, an effort to overturn rulings by lower federal courts, which have held that states' rules requiring some residents to work or prepare for jobs to qualify for Medicaid are illegal. The other case involves an attempt to overturn the entire Affordable Care Act. According to the individuals inside and outside the administration, the order to reopen the federal insurance marketplaces will be framed in the context of the pandemic, essentially saying that anyone eligible for ACA coverage who's been harmed by COVID will be allowed to sign up. Quote, this is absolutely in the COVID age and the recession caused by COVID, according to a healthcare policy leader. There is financial displacement we need to address. And the reopening of healthcare.gov will be accompanied by an infusion of federal support to draw attention to the opportunity through advertising and other outreach efforts. Statistically and interestingly, many Trump supporters are recipients of the Affordable Care Act or Medicaid. There have been Republican governors who, after mouthing off against it, expanded it in their state because they had the need and they had no choice. We'll have to see if this is just a bipartisan deal when we, see this being the legislative part that Congress needs to approve, especially for funding, how they're going to vote. I think you're going to see some Republicans on board simply because of their constituents who are suffering and really need affordable care and don't have an option in their state currently to have that. By the way, reopening healthcare.gov, reversing the Trump administration's stance that supporting such outreach was wasteful. During its first 2 years, it slashed money for advertising and for community groups known as navigators that would help people enroll. Now, it's not clear whether restoring outreach will be part of the Biden order or will be done more quietly within federal healthcare agencies. Federal rules allow already people to qualify for special enrollment period to buy ACA health plans if their circumstances change in important ways, including losing a job. But such exceptions require people to seek permission individually, and many are unaware that they can do so. Trump health officials also tightened the rules for qualifying special enrollment. Let's rip another. Senate Majority Leader, Senate Minority Leader Mitch McConnell has abandoned his demand that Democrats state in writing that they would not abandon the legislative filibuster. McConnell was never going to agree to a 50-50 power sharing deal without putting up a fight over keeping the 60-vote threshold. Let's be honest, Democrats wouldn't have either. But the minority leader ultimately caved after it became clear that delaying the organization resolution was no longer feasible. And this is what we're hearing. Centrist Democrats, Joe Manchin, a Democrat in West Virginia, and Kyrsten Sinema, a Democrat from Arizona, privately indicated to McConnell that their long-held views that they would not vote to end the filibuster. And right now it's a 50-50 Senate. So if you have two Democrats in your pocket, right, McConnell seized on those promises as an escape hatch, as well as leverage to use over the members in case Democrats take up the issue in the coming months. McConnell will give a longer take on the filibuster in his floor remarks today. What they're saying. Today, two Democratic senators publicly confirmed they will not vote to end the legislative filibuster. With these assurances, I look forward to moving ahead with a power sharing agreement modeled on that precedent. And that's McConnell. Schumer spokesman Justin Goodman said in a follow-up statement, quote, "We're glad Senator McConnell threw in the towel and gave up his ridiculous demand. We look forward to organizing the Senate under Democratic control and starting getting big, bold things done for the American people. Let's rip another." Senator Bernie Sanders, not the meme, but the actual guy, the senator independent from Vermont, incoming chair of the Senate Budget Committee, who caucuses with the Democrats, he told CNN State of the Union on Sunday that Democrats plan to push a coronavirus relief package through the chamber with a simple majority vote. He said budget reconciliation would allow Democrats to forego the Senate 60-vote requirement and could potentially speed up the next relief package for millions of unemployed Americans. Democrats hold 50-50 split in the Senate. Vice President Kamala Harris will serve as the tie-breaking vote. They did this, by the way, with the Affordable Care Act back in the day. What we cannot do, Sanders said, is wait weeks and months to go forward. We have got to act now. Absolutely. That's what's ripped from the headlines. I'm Leslie Marshall. Didn't get through all my stuff, so sorry, Marky Mark. You helped me and give me so many great ripped pieces, but some of them are so long. I want to be not concise, but I want to be comprehensive. And I'm Leslie Marshall. Quick break. When we come back, our guest and yours.
Hey, Dad, how do airplanes fly? What's in this box?
Mark?
Can I touch this? Where does sand come from? Is this tree good for climbing? What happens if I mix these two things together? How are babies made? What does this thing do?
Kids are curious about everything, including guns. Talking to them about gun safety in your home is a good first step, but you can do more. Always keep your guns locked, unloaded, and stored separately from ammunition. Storing your guns securely is the best way to prevent family fire, including unintentional shootings. For more information on safe gun storage and ways to keep your family safe, visit endfamilyfire.org. That's endfamilyfire.org.
What do we keep in the attic? What's this thing called? Can I ride my bike backwards?
Like I said, kids are curious. It's up to us to keep them safe. Brought to you by End Family Fire, Brady, and the Ad Council.
Wake up and text. Text and eat. Text and catch the bus. Text and miss your stop.
Wait.
Text and be late to work.
Sorry, I'm late.
Text and work. Text and pretend to work. Text and act surprised when someone calls you out for not working.
Who, me?
Text and meet up with a friend you haven't seen in forever.
Hi.
Oh, hey.
Text and complain that they're on their phone the whole time. Text and listen to them complain that you're on your phone the whole time. Text and whatever. But when you get behind the wheel, give your phone to a passenger. Put it in the glove box. Just don't text and drive. Visit StopTextsStopWrecks.org. A public service announcement brought to you by the National Highway Traffic Safety Administration and the Ad Council.
What does your toothbrush, a fish dinner, and your running shoes have in common? Plastic. We now live on planet plastic. Billions of tons of waste from everyday products made of these chemical contaminants are strewn literally everywhere. On the highest mountaintops, into the deepest seabeds, in dense tropical jungles, and all across barren deserts. It's estimated, for example, that in less than 30 years, the gross volume of discarded plastic in our oceans will outnumber fish. From grocery carry-out bags to shower curtains to almost invisible bits of microplastics, the vast tonnage of this trash increases every minute, with an afterlife lasting centuries, wreaking havoc on ecosystems, destroying species, and infusing our water, air, soil, food, and us. Consider just two common products, your toothbrush and your sneakers. Until the 1930s, toothbrushes were made of degradable natural components. Since then, practically all have been throwaway plastic brushes. But there is no away, so nearly all of the trillions of brushes we've discarded in the past century are still out there, somewhere on the land or in our water. Moving from your teeth to your feet, consider that millions of sneakers are sold in the U.S. each year, advertised as being athletic and cool. What's uncool is that they're made almost entirely of melted and molded plastics that are practically impossible to recycle. So, after a short time in our closets, sneakers spend an eternity as globs of toxic plastic trash. This is Jim Hightower saying we're being choked by our own synthetic waste, from billions of plastic bottles and cigarette filters to tons of straws and synthetic rubber tires. To help stop the insanity, contact Beyond Plastics, beyondplastics.org.
And we're back, and we're glad to have our next guest back as well. In the house today is Dr. Bob Bollinger. He is the Raj and Kamla Gupta Professor of Infectious Diseases at the Johns Hopkins University School of Medicine. He holds joint appointments in international health at the Johns Hopkins Bloomberg School of Public Health and in community public health at the Johns Hopkins School of Nursing. He is founding director of the Center for Clinical Global Health Education, the CCGHE, and the center is doing a lot of COVID-19 related work here in the United States and beyond our borders. Check out their website, main.ccghe.net. On Facebook, you can follow them there or like them there and become friends there, facebook.com/CCGHE. Dr. Bollinger, thank you for joining us and coming back on the program. I'm sure you're busy, and I appreciate you taking the time. Good afternoon and welcome.
Good afternoon, Leslie. Thanks for having me back.
Okay, some people out there are getting Moderna. Some people are getting Pfizer. My husband's getting his this week. I think it's Pfizer. Both you have to get 2 injections, right? There's a first injection and then a second. But there are a lot of people out there that are saying, what about these new variants that are coming up? How effective are these vaccines from Moderna, from Pfizer? Moderna is saying that their vaccine for COVID-19 is effective against the new variants of the virus, first appearing in the UK and then South Africa. Can you speak to us about that? Because some people obviously already afraid of getting the vaccine, and even those who aren't are frightened it might not be enough with these variants.
Well, I got my second Pfizer shot last week, so I'm encouraging people to get the vaccine as well if when their opportunity comes up. Look, we've had variants of this virus around since the very beginning of the epidemic back in December of last year. So these are RNA viruses. They mutate when they replicate or make copies of themselves routinely. So this is not an unexpected thing. The current vaccine strategies that have been, distributed, the Pfizer, Moderna, they're looking carefully at the immune responses to make sure the antibodies that they induce work against these new variants. And in some recent studies that were done with the NIH and others, it looks to be like there may be somewhat reduced what we call neutralization from the antibodies induced by the vaccines, but they seem to be work pretty well. And so I think we should have some confidence that they're going to provide benefit with these new variants.
For clarification to those of us like myself that aren't medical personnel in layperson terms, possibly, doctor, the vaccine was as effective against the strain from the UK, I'm hearing, but they did see, speaking to your point, a six-fold reduction in antibodies against the South Africa variant. Are these two separate variants? And if that's the case, would it indicate that the South African variant is tougher to control?
Well, we'll have to wait and see. There might have been a reduction, but there was still apparently sufficient neutralization against the South African variant that makes us have some confidence that the current vaccines are going to continue to work even for that strain as well. We'll just have to see. Listen, we have dealt with this kind of thing before. We've had decades of experience with the influenza vaccine, for example, that has to be adjusted and tweaked every year. So we can deal with this, and I think we just have to monitor it carefully and follow it, and that's exactly what the scientists are doing.
Well, absolutely. As you said, the neutralizing the antibodies generated by the vaccine remain above levels that are expected to be protective. What is the main difference between, if you can speak to that, the Moderna and the Pfizer vaccine, or does it really matter which people get? I mean, because I know some people are asking that question of my husband, even though he's an orthopedic surgeon and doesn't know the answer.
Well, they both have shown really excellent protective benefit, specifically protecting against illness, particularly protecting against people getting significantly ill from COVID. So both vaccines work similarly well in that regard. They haven't been compared head to head. Studies have been done separately, but they both show excellent, greater than 95% protection against COVID disease, COVID illness. So that's great. And I think they're both similar technologies. They're both what they call mRNA technologies. They have slightly different manufacturing components, but the Pfizer vaccine right now has to be kept at a colder temperature than the Moderna vaccine, but they're both very similar. It's not recommended routinely that they be swapped in and out. You really should get, if you're going to, get the first shot with one vaccine, you should get the second shot with the same vaccine if you can, and because that's the way they were evaluated. So we know the data for that. We don't know is whether it's going to make a difference whether you switch, for example, get one with the other, one with one vaccine, one with the other, and those studies need to be done, but they haven't been done yet. So I think most are recommending you stick with one or the other, and they're both excellent choices.
Now,
I would get
now,
whatever one's available to you.
Right. Right now, you get the first vaccine, and how much time has to elapses between the first and the second?
So for the Pfizer vaccine, it's about 3 weeks, and for the Moderna, it's about 4 weeks.
And after that, does an individual need to get an annual vaccination like we do with the flu shot going forward?
Well, we don't know yet, but it's certainly possible. I know that Moderna would be surprised if the other companies as well aren't already, beginning to think about that, because we do that, as I said, with influenza all the time. So if necessary, we could certainly, see that happening. At this point, it doesn't seem to be necessary at the moment, but we'll just have to track and see what happens over the next year.
You mentioned that you just got your second vaccine. I have friends in healthcare, or in various areas of healthcare, like pharmaceutical example, that had their first or second dose. Some people felt the first vaccine, they had some side effects, not the second. Some people, the second, not the first. Some people had no side effects either way, and some people had side effects with both. Should people be concerned about these side effects? And if you don't mind sharing, did you experience any?
Sure. Yeah. No, I had some side effects. I had a sore arm, and I had a fever, and maybe some body aches for about a day or so. Took some Tylenol. That was it. After the second shot, didn't feel much with the first shot. But I was fine with it. I think it was actually, I've had other vaccines as well, including the Shingrix, which I had, even more reaction to than the COVID vaccine. So
Are
they were
you
mild symptoms.
eavesdropping on my my cocktail hour with my college girlfriends? Because that's exactly what my friend who's the pharmacist said. She said I was sick. She goes like crazy with the shingles vaccine. She goes, the side effects for this weren't as bad. Very interesting. You had
Yeah, I mean,
very similar experience.
yeah, I mean, the side effects are expected with any vaccination, right? And you have to weigh the side effects against the benefit and the
Absolutely.
risk of not getting the vaccine. It's not even close. I mean, the calculus is not even close.
Right.
The benefit of this vaccine of preventing a deadly disease and a severe illness, perhaps even long hauler side effects, we'll have to see about that, greatly outweighs, the inconvenience of a sore arm. Let me put it bluntly, I'd rather have a sore arm and a headache for a day than a tube in my throat and a ventilator for a week.
Absolutely. Doctor, to that point, are you surprised, even though numbers are coming up and confidence in those who say they'll take the vaccine, are you surprised about people who are hesitant, especially the numbers within healthcare who are hesitant as well?
Well, I mean, I'm surprised perhaps a bit about the healthcare numbers, but look, there's been vaccine hesitancy, and certainly in our country and in Europe in general, long before COVID. There's a lot of misinformation out there, a lot of, frankly, untrue things that are said about vaccination and the risks and benefits, and that really confuses people. And I think that's we as a healthcare and public health are partly to blame for not being more clear in the way we communicate, consistent in the way we communicate about these things. So it's not a surprise that there's vaccine hesitancy. The other, of course, is that there's a lack of trust in some communities of healthcare and particularly communities that are disproportionately affected by COVID, right? So there's going to be a lot of vaccine hesitancy. We have to work really hard to overcome that, because the communities that need the vaccine the most are the ones that might have the biggest both structural and hesitancy barriers.
Absolutely. Well, Moderna, by the way, now says it's developing an additional booster dose against the South African strain and another booster to fight other emerging strains. So for those that might be worried that strain seems stronger, they've already got their finger on the pulse of that. We're going to take a break. When we come back, we're going to talk about the political aspect, but not politics as much as what's being proposed by our new president regarding vaccinations and his goal and the numbers surrounding that. We'll be back with our guest, and we'll be back with you. I hope you'll stick around to have more with Dr. Bob Bollinger, the Rajan Kamla Gupta Professor of Infectious Diseases at the Johns Hopkins University School of Medicine. Back after this.
Follow Leslie on Twitter. Just go to www.twitter.com/Leslie Marshall, and we'll be sure to share your tweets.
America, your children have an amazing superpower. They can help save lives by not having play dates. That's right. By replacing get-togethers with virtual play dates and video chats, they can help slow the evil spread of germs. And if your superheroes do go outside, make sure they continue their superhero wing by staying 6 feet away from others to protect everyone in America land. Find out more at coronavirus.gov. A message from the CDC and the Ad Council. America, your children have an amazing superpower. That's right. They can help save lives by simply washing their hands. Just 20 seconds of thorough hand washing after they've coughed or sneezed or been outside can help fight against the dastardly spread of germs. Armed with only soap and water and hands, your superhero can protect you, your family, and everyone out there in America land. Amazing! Find out more at coronavirus.gov. A message from the CDC and the Ad Council.
Welcome to Code WAC, your podcast on America's broken healthcare system and how Medicare for All could help. I'm your host, Brenda Gazar. How are incarcerated populations faring during the coronavirus pandemic, and what more can be done to protect them? I recently spoke to Dr. Nina Harawa, a professor in residence at UCLA's David Geffen School of Medicine, to find out. Her opinions are her own. Welcome to Code WAC, Dr. Harawa. You've worked with incarcerated populations who have been hard hit by COVID. Can you talk about the susceptibility of incarcerated people to COVID-19?
It's just been absolute travesty how it is that incarcerated populations have been affected. The rates of mortality from COVID are about 3 times that of the general population when adjusted for age. We've had these terrible outbreaks in, specific facilities, including San Quentin, where multiple people died within a few months. Incarcerated populations are extremely vulnerable, primarily because they can't social distance, right? They are in either dormitories or cells, generally with other people that don't allow for social distancing. Even if you have protective equipment, I would doubt that people are going to sleep with masks on. I don't even know if that would be advised. And so people are living 24/7 in a setting in which there's that risk. Definitely needs to be more research on this, but my conclusions has been based on the way airflow and ventilation works in different settings. Even people in isolated cells seem to be at risk because there were several death row inmates in San Quentin who contracted COVID-19 and died.
Get the full Code WAC story on progressivevoices.com and on the PV app. Catch all our episodes by subscribing to Code WAC wherever you find your podcasts. This podcast is powered by Heal California, a nonprofit that uplifts the voices of those fighting for healthcare reform around the country. Until next time, stay healthy.
If you miss Leslie on TV this week, catch up at lesliemarshallshow.com.
We are back. Welcome back. I'm Leslie Marshall. Our guest is Dr. Bob Bollinger. He is the Raj and Kamla Gupta Professor of Infectious Diseases at the Johns Hopkins University School of Medicine. He holds joint appointments in international health at the Johns Hopkins Bloomberg School of Public Health and in community public health at the JH School of Nursing. He is founding director of the Center for Clinical Global Health Education. They do a lot of COVID-19 related work here in the United States and throughout the world. Thank you, Dr. Bollinger, for holding, and welcome back. President Biden yesterday said that he believes America will be on track for 1 million vaccinations a day within the next 3 weeks, with the possibility of soon upping that number to 1.5 million vaccinations a day. One, overambitious, or is that number possible? And is that number still too small from your perspective as a medical professional?
Well, I mean, we have to get the numbers up. It really depends on the amount of vaccine that's available. I think if we have more vaccine available, we can get it out there and get it distributed. I think we're learning, some lessons about how to do this more efficiently. There's some states doing a better job than others to get it out, and so we're going to learn from each other. As soon as we get more vaccine, I think we'll find ways to get it into arms. That's the most important thing. It's not the vaccines that are to make the difference. It's the vaccinations. So we've got to get those vaccines into people's arms, and we've got to do it, at a higher pace than we are now, if we're really going to turn this around by the spring or summer.
Yeah, that's what the president said. He said yesterday that he thinks any American who wants the vaccine can expect to receive one by spring. He said, quote, "I feel confident that by summer we're going to be well on our way to heading toward herd immunity." To that point, Dr. Anthony Fauci said the same thing. He said if a high percentage of those who can in our nation can be vaccinated, then we could be looking at possibly not only reaching herd immunity, but starting to re-enter life as we knew it prior to COVID by September. Overly ambitious or possible?
No, it's certainly possible. We could even do it faster if we would, in the meantime, while we're waiting for the vaccines, stop spreading the infection to each other. There are things we could do now while we're waiting for the vaccines that we haven't done for well enough for the last 10 or 11 months that we could do now that would greatly help. So we have to continue to do all the other things that Dr. Fauci and others have talked about to reduce the risk of transmission while we get this vaccine, the different vaccines rolled out. We also have other vaccines in the pipeline that hopefully in the next few weeks or months will be available to add to the stockpile that we need. So I have a lot of confidence that we could do it. It's going to take everybody working together, and we can't rely simply on the vaccines.
President Biden has been president less than a week, and I'm not asking you politically. I'm just asking you realistically. We're hearing that the newly appointed CDC director, Rochelle Walensky, over the weekend said that this administration does not know the current number of COVID-19 vaccines available, and that was due to a lack of data gathering by the agency under the former administration. She said that the unclear inventory has made it more difficult for states to accurately plan their distributions. Even though it's been less than a week, are you noticing any differences with regard to vaccinations or regard to fighting this COVID-19 virus between the former and the current administration from your perspective in healthcare?
Well, obviously, it's too early to tell if things are going to, change substantially, but we certainly hope so. And I have a lot of confidence in Dr. Walensky, who, by the way, is another proud Hopkins alum, who I have a lot of confidence in, as well as a lot of the other members of the new COVID task force. And of course, Dr. Fauci is still there. So they're excellent advice. And I think if, at the very least, we're seeing an improvement in the communication, and the consistency in communication already, which I think is extremely important.
Herd immunity minimum is 70%, about 2/3 of the population. Am I correct in that?
Well, that's a guess. We'll have to see. But that's what the current model suggests. And then remember, of course, we've got to include all the children in that calculation, right? And we don't have a vaccine yet that's a formulation that can be safely given to children. We're still trying to determine, whether these vaccines will be safe and effective in the kids. And once we do that, we're going to need to figure out how to get kids vaccinated, because kids may not be at risk for getting sick, but they're at risk for getting infected and then spreading the infection to others that come in contact with at home, in the community, in school, et cetera. So it's not just the adults, it's the children have to be protected as well for us to get a handle on.
Yeah, we need to inoculate the vast majority of adults. And like you said, you have to have the vaccines, get them out there, have people willing, get them into their arms. It is a major undertaking. I do not envy those, who are in any way involved in this, whether it's healthcare on one end or politics on the other end. So looking at numbers, to get to approximately 70% of our population by July 4th, by Labor Day, we would have to have 1.9 million doses per day to reach herd immunity by the 1st of next year. We need 1.2 million doses per day. Let me ask you two questions. Because it's so early and because this vaccine was created so quickly by Pfizer, Moderna, and other organizations the United States is not using, like Oxford over the pond, as they say. One, the vaccine, helps your immune system fight off COVID, but it doesn't necessarily. They don't know, I would imagine, if you're a carrier in any way. Does it prevent you from spreading that to someone else, correct?
We don't know the answer to that. And look, there's a recent example that illustrates that very clearly. So as you may recall, there have been a number of members of Congress who were infected since the 6th of January, who were, locked together in a room, unfortunately, for that day. And subsequently, I think there have been at least 8 congressmen additional congressmen or women that have been diagnosed with COVID positivity. Yes. Many of them have been vaccinated before, right? They may not have had enough time for the vaccine to induce enough immunity, because I think, I may be wrong, but I believe the Congress some of the members of Congress had access to the vaccine around mid to late December. So some of those same folks who got infected had at least one vaccine already. So that now I'm only aware from the public record that there are only 2 of those who are symptomatic, and they've had mild symptoms, and we hope that continues. So maybe there's some therapeutic benefit, but the fact is that they had a positive test. So the virus was in their nasal passages, despite the fact that they'd had at least one vaccine. Well, that illustrates a couple things. Number one is it takes time for the vaccine to work. Number 2, it probably takes, and we think this is true from the data, at least two shots for these vaccines to have maximum protection. And number 3, it may protect against people from getting sick, but not necessarily from getting infected. So that means having the virus in their nose. And so theoretically, those same people could be infectious to others. We just don't know the answer to that yet.
And because we don't know this, doctor, would it be wise, and do you think that Fauci and those out there like yourself are going to recommend continuing to wear masks even if you've been vaccinated?
Oh, absolutely. In fact, if you see Dr. Fauci, who's been vaccinated, he's still wearing a mask. for exactly that reason. Absolutely.
Yeah. Do you think, I've read somewhere that we'll probably be wearing masks well into 2022 and we may never return to life, quote, as we knew it before.
Well, I'm not sure about that, but I wouldn't be surprised if we have to wear masks for a longer period of time while we allow the vaccine to really take hold and herd immunity to kick in and wrap this up. We may find that, there are lots of societies where during flu season, a lot of people wear masks. A lot of Asian societies, it's routine, right? We could be having a similar situation here for a while, but I expect them to get a lot better. And I just wish they would get better sooner, and we could certainly contribute to that by not waiting for the vaccine. But when it is our opportunity to get the vaccination, but in the meantime, wear a mask, continue your physical distancing, and all the other steps that are necessary.
Right. You had mentioned more vulnerable communities, and those especially are communities of color. They are falling behind in the effort here in the United States for vaccines in cities throughout the nation. These neighborhoods that were, like, as you had mentioned, rightly so, they were hardest hit by the coronavirus. They're being vaccinated at a much slower rate than wealthier, whiter counterparts. And preventing socioeconomic disparities in the vaccination, we knew would be an uphill battle because some of these communities are very untrusting of government or of medicine, based on history. What else can we do, to help in those communities because these people are being affected disproportionately by COVID?
Oh, absolutely, and we need to do a lot more than we're doing now to address that disparity. Listen, the reason people are not having the same access to vaccines are many of the same reasons that they're having increased risk of COVID and increased mortality because of the structural barriers, the lack of access to care, lack of, if people can't get primary care, how are they going to get a vaccine, right? If they live in communities where they live far away from healthcare or from vaccination centers, or if they don't have access to the, internet in order to go online to sign up for a vaccine. There's so many structural barriers that are not only limiting their access to vaccination, and as well as you said, increasing the distrust of healthcare systems and of the vaccine itself. These are the same disparities that are the reason why these communities have such high rates of illness and death from COVID.
Yes.
As well as.
Yes. Doctor, thank you so much. The hour just flew by, or the half hour that you were with us today. Thank you for taking the time, and thank you for all that you do as a physician fighting this pandemic and trying to get us back on track and get our lives back to normal. Dr. Bob Bollinger, Rajan Kamla-Gupta, Professor of Infectious Diseases at the Johns Hopkins University School of Medicine. Like I said, he's founding director at the Center for Clinical Global Health Education, CCGHE. Check out their website, main.ccghe.net, on Facebook, facebook.com/CCGHE. A shout out to Mark Grimaldi, my executive producer. I'm Leslie Marshall, back with you later this week.